Ladies and gentlemen, time and space do not permit me to have any long, lengthy critique of this book here. But I will say in summary that Dr. Sanya Nishtar's book takes stock of the health systems reform in Pakistan in a historical perspective. It correctly differentiates between a health system and a healthcare system. Ladies and gentlemen, this is the point to consider. She very accurately, perceptively differentiates between a health system and a healthcare system. And she addresses the burning issues of the health sector, including governance, financing, and service delivery. She considers the health information system to be the heart of the matter, a kind of a pulse and a kind of an indicator of the state of affairs that the system is in. And at the end of the book, and this is very significant, she comes up with a reform agenda in 4 stages. This gives the book an aura of authenticity and an air of credibility, and I would strongly commend the people, the professionals, the citizens, the people who are involved with the health sector issues to go through the synthesis that ends in the action plan that I spoke about. Ladies and gentlemen, this book could not have come out at a more opportune moment, because today in Pakistan there is a debate taking place on the national health policy, a new national health policy. And so let me tell you that when I was the Secretary Health and with Dr. Ishrat's help, because he was then on the other side where we were arguing for national health policy, which is health policy and not healthcare policy only, because at the end of the day, you may be worried about the health of the pipes, but it is the health of the people of Pakistan that you should worry about, and that is why you have to travel from healthcare to health of the people of Pakistan. And so we said that we must empower the health division not only to act as a clerk, but to act as a clerk with a brain in the head, and to think about the kind of issues that Dr. Sanya Nishtar has thought about. And we would have expected, sir, that many books like Dr. Sanya Nishtar's publication would have come out from the National Health Policy Unit that was devised, as I said, with the help of Dr. Ishrat in those days. But I suspect that the National Health Policy Unit became a kind of a gaushala, a cowshed, where the bureaucrats like me, and I'm guilty also, just wanted to exercise the great power of posting and transfer, and at the end of the day, I'm glad this book has come out from Dr. Sanya Nishtar, and nothing has come out by the grace of God from the National Health Policy Unit. So it is very good and opportune. It is very good and opportune that a ready-made analysis and some kind of a synthesis is available to the policymakers of the day. So allow me, before concluding, to say just a few things and a few issues that this book will talk about and identify for us. First of all, as I said, the context is very important. This is not just healthcare, it is health, and therefore I see the echo of the WHO concept of health. Dr. Bele, with his characteristic professionalism, brought it out today in his speech. I think that this much quoted, but much honored in the breach then in the observance definition of health, that it is, you know, the approach is one of complete physical, mental, and social well-being, and not only the absence of disease or infirmity. Not only the absence of disease and infirmity, but the entirety of health. That is what matters. But I find a lesser quoted, but a much more comprehensive definition in what is known as the Ottawa Declaration or the Ottawa Charter. And I would like to just share that with you, ladies and gentlemen. It talks of health as individuals or groups ability to identify and realize aspirations. That is health, not just that you don't have disease. To satisfy needs and to change or cope with the environment. Health, therefore, is to be seen as a resource for everyday life and not just an excuse for living, not just an objective of living. So this is the context. So if you are looking at pipes, ladies and gentlemen, look at the context also. This is the context in which Dr. Samia Nishtar is speaking about. I like the phrase in her book, the service of welfare, the delivery of welfare. That is the aim of health. And if that is the aim of health, then in the modern social welfare state, I think there is enormous academic and professional consensus on what constitutes a welfare state and what constitutes welfare. Sir, the state has a moral obligation to provide direct inputs for the poor. This is not a favor. This is part of the welfare state. And therefore, the networks and the risks that the poor have, that have to be attended to by the state. There can be no, when you talk of the private sector, when you talk of private-public partnership, please have your framework right. When there is enormous poverty in a country, the obligation of the health sector is to provide for the poor. That is now an ABC of welfare. Then if you go up through microcredit, through initiatives, you enlarge opportunities for people, and they should strengthen themselves through the community and through organizations which the state should promote, so that they are strengthened to benefit from the interventions of the state sectors and the state interventions. That is the second element. And the third element is that those who have power and those who have wealth, please give them a good, fair and just playing field so that they can enlarge their economic and social wealth through fair competition. So that is where the market comes in. But here we are very confused. We will use terminology which should be applied to the third segment for the first segment and for the first segment to the third segment. Now that clarity is required. If that clarity comes about in the concept of welfare, I think what Dr. Samia Nishtar has been talking about will become much more clear. Dr. Samia Nishtar has spoken about a triad, T-R-I-A-D, a triad of determinants which she considers comes in the way and produces these clogs in the pipes. And what are these? I just mentioned these to you. These are low investment, low spending, poor regulation, and lack of transparency in governance. This is the triad that she speaks about. But from her very book, I call it the unholy triad. But from this very book, you can find out the elements of a holy quartet. And what is that holy quartet? And this is the consensus. I think this is based on universal consensus that public health should constitute universal health and welfare coverage, safe living, decent livelihood, and people-centric governance. And I think this is the message that the book brings out. Now, sir, for this kind of a vision, you need a social sector approach. You can't deal with a departmentalist health approach. Ladies and gentlemen, this is the essence of the matter. You can't use rhetoric to analyze and then come up with a departmentalist vision to produce results. No. Now, in this country, we were always thinking that this social sector vision should be housed somewhere. Can it be housed in the Ministry of Health? We thought that the Planning Commission of Pakistan and the Social Sector Committee of the Cabinet and the Social Sector Wing of the Planning Commission will be the custodian of this vision, and that is when your ratio of health expenditure to GDP will go up and welfare will go up. You need a house for these things. You can't do it on the basis of rhetoric. But sir, if there is one committee which never meets in this country, I remained cabinet secretary for 3 years, I remained health secretary for 4. If there is one committee that doesn't meet, it is the social sector committee of Pakistan. So this is very important, that if you are genuinely requiring a social sector approach, then sir, and if you have a clear architecture of what is welfare, a clear architectonics of welfare is in your mind, then there is some political committee and therefore I think we bureaucrats or formers more and rush through these 1 or 2 points which I picked up from the book, and therefore I believe, sir, that in the future, if that social sector vision has to come about, the Ministry of Health will have to change its role from direct service delivery to partnering in policy formulation and in measuring the outcomes of the implementation of that policy. This is very necessary then if this vision has to come about. And this is very important in the context of the NFC award. This is very important in the context of discussion on autonomy. This is very important that the ministries at the federal level now develop that social sector vision and are then able to implement the same. One of the points of the 2001 policy, Dr. Sanya, which I think I don't see reflected in this book, is that being a federation, we were able to develop the concept of the national health program, not a federal health program, not a provincial health program, but a national health program. And I said that if you want to include the DOTS strategy as part of the national architecture of the services, then please let it not be a federal intervention. Let it not be a provincial. Can you partner together? And where is the PC1 of the province? Where are the resources? And we were able to develop, and this is the kind of architecture that will be necessary in the new political and economic circumstances that I speak about. Don't please throw away the baby with the bathwater. These are very valuable on basic issues. Can the province and the nation come together, and the federal government come together and develop a national vision? That is where, and therefore, institutions where the national vision is preserved, this is crucial, and this requires to be thought about, and therefore, these are the kind of institutions which we require to further buttress. Connected to this, of course, is the question of almost a problematic now of population and health. Ladies and gentlemen, this has been identified in the book. We will talk, we know the state of affairs of the population scenario in Pakistan. We know that the IMR, the MMR, the contraceptive prevalence rate doesn't go above 28 to 30%. We know that the TFR, the total fertility rate, believe me, with all the push and pull, is not going beyond 4, is not coming below 4. And you know what it means at the end of the day. But we will have 2 ministries, we will have parallel interventions, and no matter what the rhetoric, I don't think that combined, that lesson, the global lesson of the integration of health and population welfare services, I think we'll have to think about it when we are thinking of choke pipes. My last point is on urbanization. Sir, I think that as important as autonomy, as important as fiscal reforms, as important as local government coming into the system and national programs, now adding the district governments to that provincial federal partnership, is the question of the health sector and the whole architecture of welfare. Take into consideration what is going to happen to this country. I understand, sir, that by the year 2050, 70% of Pakistan will be living in the urban areas. Already by 2030, it will be 50%. And 58 million people, or 1/3 of the people of Pakistan. And then who are these urban people? Sir, 33 to 35% live in slums. And please remember one thing, that the Lady Health Worker program, which was our answer to the question of access of basic health and human services to the rural population, has failed in the slums.